Hi, my name is Ken McKenzie, and on behalf of Keith Buck and myself, we would like to welcome everybody globally watching this presentation. At this time, I'd like to introduce Dr. Yasser Saeed. Doctor, take it away.
Thanks, Ken. My name is Dr. Yasser Saeed. I'm a board-certified physician practicing in the US in internal medicine, general pediatrics, and pediatric hospital medicine. And I've also been fortunate in being able to treat many patients with severe COVID in the hospital, in the ICU setting, as well on the floors. So we've had a lot of early challenges with screening for COVID, especially before it really reaches the symptomatic period. And that's because the viral loads tend to be lower. This makes it hard to detect for many tests. There's also challenges with testing children who don't like, for example, a nasopharyngeal swab or something invasive of that nature. In addition to that, there's many logistic challenges that occurred just because certain testing modalities require a lot of resources to administer, to manage, to report, and the entire kind of supply chain cycle. The timing of COVID-19 symptoms is something that we've learned a lot about. So many of the symptoms people think of with COVID are things like cough, fevers, muscle aches, also known as myalgias in the medical field. And then in many people who have a GI variant, they can have vomiting or diarrhea. Unfortunately, many of these symptoms occur later in the disease course. They can occur as late as day 5 or 6, or in many cases later than that. And by that point, the individual has already possibly spread the COVID virus to many other people. Next slide. So as we referred a little bit in the prior slide, fever occurs in, it can be a late finding. In some patients it happens early, but in many of the patients with COVID, it happens later, day 5, day 6, and it doesn't occur uniformly in every individual. So using fever alone as a measure of who has COVID is a way to get more people infected. Antigen tests have a very important role in the testing of COVID-19, especially for patients who are symptomatic. If you have someone in front of you with a fever and a cough, an antigen test can be a great way to confirm whether or not they have the disease of COVID. However, earlier on, when the patient is not symptomatic, they're not as reliable to determine who has this disease. PCR testing is the gold standard for knowing when someone has a disease. However, there are many limitations of PCR testing. For one, the test modality is often invasive. For another, you need a very significant logistic support system for that test. Someone has to collect it properly, they have to store it, they have to ship it, and then the results take a while to come back. So that can be too long, and it's very difficult to scale PCR testing if you're trying to get disease activity down in a population. So, what's interesting about the Corowell test is that they're going after something that occurs a little bit earlier in the disease course. So research has developed around COVID that shows that the sense of smell and taste can be impacted earlier in the disease at a level that the patient might not even recognize. So you can have COVID and you can start to lose your sense of taste or smell as early as day 1, day 2 after getting the virus. And you may actually not even be able to detect yourself that you have that symptom. So if there was a way to know that somebody was having that finding within themselves early on like that, that would be potentially a game changer for the detection of early COVID. And that's what we're hoping we have here. And I'm going to turn it over to President of OPU Labs, Mark Bookman.
Mark, you're on mute.
I'm sorry about that. Excuse me for that. So let me repeat. So Dr. Saeed, thank you very much for that excellent presentation. And I'm going to now talk about how the test actually does detect the hyposmia in people in the early stage of COVID. So as you can see from the slide here, the way this test works is that there's a card with a QR code and an app. And you use the app, you grab the QR code, and that activates the test. The green box and the card on the bottom left is the scent area where you scratch it, and then you will smell to see what the scent is, and then go through and answer some questions. So let everyone go to the next slide. So the steps are grab the QR code.
This is the next slide.
Oh, okay. Yep. So you scan the ticket, you scratch the card, you smell it, and then you answer the questions. There are a few questions about COVID in general. For example, if you've been near someone who has had COVID, if you've been tested recently, et cetera, et cetera. At the end, after you answer the questions, and I'm going to explain a little bit more about those in a moment, you'll get a pass or a fail. And so if you fail, it's saying that there's something with the way you answer the questions that indicates that you have hyposmia, that you did not detect the smell correctly. If you pass, then it's saying that it did not detect any problem with your ability to smell, and therefore you likely do not have hyposmia. That is what the test does. So the questions that are being asked are essentially, first, what is the smell? You go through the list and have to pick the smell. For some people, it's easy. For some people, at first, you smell it the first time and you're not sure what it is. It usually takes people a couple times to smell the card, look at the list, and then make the decision. And this is normal. And I'll explain that in a moment about what's going on with the brain. But basically, it takes people a few times to smell it to figure out what it is. Then at the end, they're going to ask you how strong was that smell? What was the level of intensity from 0 to 10? And then you need to go through and pick that intensity. Now, the card is encoded with the smells in a way which you don't know exactly what the level of intensity for that particular smell is, and you need to get it all right to pass the test. So it's a very clever test, and it does a great job at trying to figure out, does someone have hyposmia? Next slide. So what's going on here with the Corowell algorithm is basically looking at the level of cognition and sensation for a smell. And they've got right now, I believe it's, there are 33 smells that have already been devised for the test. They're adding another 25. So it's 58 smells that are regionalized around the world for the different abilities of people to smell and detect different scents. And now, as Dr. Saeed explained, in the early stage of COVID, you start to lose that sense of smell, and you don't really realize that you have yet. Now, the the Corowell research team has actually looked at the exact smells that COVID impacts. And so the smells are put on the card in a way that will help determine if you have COVID. Some people have smell disorders. Some people have sinus infections, or maybe they're not familiar with certain smells. But what Corowell is actually doing is looking at the smells that are impacted by COVID itself, and then asking you to detect that smell and the level of intensity. So it's a very effective test. So let's now talk about, next slide, please. Let's talk about then the efficacy of this test so far. The test is registered as a Class 1 medical device in the US, Canada, EU, and Mexico. It's got Medicare designation now. It's been approved by OSHA, and they have CE marks for the various components of their test in Europe. Corowell is now working with the FDA on getting an EUA, and we understand that it's at the very late stages, and we're expecting to see the EUA issued for this test in the US soon. Next slide, please. So in terms of the actual data that they've gathered, they've done about 30,000 tests, and in these tests, they've matched the users against PCR tests. So they take the Corowell test, and then later there's the PCR test, which will then be the data that they'll compare themselves against in terms of their accuracy. And what we're seeing right now is, with the testing they've been doing, is that there are very few false negatives, meaning that Corowell is not passing people through who have a risk of COVID or who later test positive for PCR. You can see in the slide here that it's 0 false negatives, 1 false negative at that level. And so it's very good in terms of, right now, probably as good as PCR is in terms of identifying people with COVID or with the risk of having it. Now, with their current algorithm, which is version 1.0, they are seeing somewhere from 1 to 3 or 4% false positives, which means they're failing people who are later testing negative for PCR. That's going to be improved a little bit. That little by little. This has to do with maybe, let's say, the way people read the card, they didn't answer the questions correctly, or maybe they have a smell disorder and just didn't pick it up correctly. But that's being improved in their later algorithms, and so they're expecting the false positives to go down too. So with the current version of Corowell, right now against PCR, the overall accuracy is about 96.8. And in the next release, which is coming out in about 3 or 4 weeks, it's going to be at 98% accuracy against PCR. Okay, next slide, please. So all the data that Corowell collects goes into the cloud, and then Corowell customers will then get access to this data that they can then merge with their reporting systems. And so what this becomes then is the most effective early warning system that we can see out there right now to have groups and organizations and venues identify people who are at risk of coming into a safe space and infecting people. Next slide. There are 2 versions of the app. One is a single user app, which is used to take the test by individuals. And then there's an app called Corowell Guard, which teachers and administrators and HR people can use to test groups. And it can also be used as a door monitor, so that once you get your pass, you can show your pass to the Guard app, and then it'll let you through and pass. Say, okay, this is an authenticated pass from Corowell. You're safe to go in. The app is currently in a bunch of languages. All the European languages are covered, and a whole bunch of languages you can see there for Chinese, Japanese, Thai, and others are coming soon. So with that, Leonard, I'll pass it over to you, and you'll address the applications and the business side of this.
Thank you very much, Mark. So part of the genius of Corowell is it's both a do-it-yourself test that can be done at home, at work, while you're traveling. Parents can test their children at home, but it also has massive applications in large venues. So if you think currently about trying to get tested outside a restaurant, a school, a workplace, a stadium, or a concert, or a transportation hub, the lines would be enormous. The waiting would be tremendous. The cost of medical personnel is prohibitive. We've reduced all of that. So the ability to test people on a self basis with the app in less than a minute, and then just show their pass screen at the entrance, is a major game saver and game changer that's taking on a lot of impact around the world. And then the very small percentages, Mark said, the 2 or 3% that may fail, then they're relegated to a different area to go take an antigen or PCR test. But to test the majority of asymptomatic people with an invasive test that takes a long time and is very costly just doesn't make sense. So as you can see here, we're testing people quickly. It's great for crowd management. It's just a very appropriate venue tool to be testing at all these venues. The tickets are also able to be branded and co-branded. So in many cases, there may be sponsors donating them. There may be an athletic team like you see here, providing them at a sporting event. So branding is always very popular to say who's involved with this humanitarian effort. So that exists on the cards as well. In America, we have reimbursements, and Mark talked about Medicare, but also FEMA and CARES Act, which is very, very important for the educational sectors, that's K through 12 and higher education, as well as nonprofits, houses of worship. So we're happy to talk with everybody offline and individually how that works in America, and then obviously helping you and working with you in your country to find out about reimbursements. In America, the Medicare codes, which we have, trigger the reimbursements for the CARES Act and the FEMA and the corporate health insurance. And something we learned today, in fact, is that the Medicare codes, the code is the same, but the actual reimbursements do vary state by state. So just because you hear somebody quote a number does not mean that's necessarily the same number that will be reimbursed in your state. If we look overall, though, we know that the antigen and PCR tests themselves are not massively expensive, but it's often the labor, the personnel, and the management, the administration that makes it very, very expensive and even prohibitive in many cases. So when you look at the test between $3, $5, $7, $30, but then $50 for labor and a couple of days to get it done, versus Corowell, which is less than $15 at MSRP, and there's no medical staff needed. So this is a very significant game changer in terms of accessibility, safety, effectiveness, and cost effectiveness. So in recap, it's fast and accurate. It's 1 minute self-administered. Non-invasive is major. Kids love it. It's fun for them. They actually look forward to it. It's safer than the nasal swabs. It's scalable with the data. No medical staff required. Sorry, Dr. Yasser. FDA registered, HIPAA compliant. The false negative is very low. The false positive is very manageable. And the product has a 10-year plus shelf life. So it's not vulnerable and it's not susceptible, and you don't have to worry about shelf life, expirations. So as we get to the end of this presentation, we want to thank you very much for your attendance and your participation. And we look forward to speaking with you personally and directly about your current testing protocols, the timing of your situation. And if you'd like to place a trial order, we'd be very happy to assist. So thank you again very much. Have a great day.